What you would be looking for is to see what is normal for your dog. So quite often it's easy to start with the nose. So if you start with their nose should be shiny, there shouldn't be any unusual discharge, and it should be a healthy looking nose. Have a look at their eyes, although sometimes with dogs they don't like you looking in their eyes. You might need to move up to that one. But you're looking at the whites of their eyes to see if there are any flecks, if the flecks are where they usually are, if there's anything unusual and different, is there anything in their eyes, is there anything bothering them. Have a look at their mouth as well. Again, this is something you might need to build up to. And if you are able to lift up the side of their mouth and have a look at their gums, see if Boo lets us do that, okay, they should be right and pink and healthy like that. Again, looking at the mouth, what you would like to do is actually push very gently on the side of the gum there, and that's your capillary refill time. If you push down on that and you let go, the colour should come back pretty much immediately. And that's a sign that they are healthy and that all the oxygenation is working fine. If the capillary refill time is slow, then that could be a sign that they're going into shock. But obviously there would be other signs as well. Have a look at her ears. Have a look at the inside and have a look behind. It's very easy for something like a grass seed to become lodged. Have a sniff of them as well, because sometimes that's an early indication that something has got stuck that you might not be able to see, and it's beginning to get infected. And if you're aware of anything unusual, then it's always as well to go to the vet and get it checked out. You then want to move down their legs and have a look at their paws. And you'd examine each paw in time. You'd have a look between the claws, again for those pesky grass seeds, and have a look at the pads of their feet, just to make sure they are completely healthy. And look at the length of the claws as well, because if the claws are getting a bit long, they can be prone to catching. And then you can keep an eye on that and check in advance. Again, you're just removing. If there is something stuck and your dog does appear a bit lame, have a look both at the top and underneath, because sometimes people just look at the pads of the feet and you can find that the issue is actually on the top. So just make sure you've examined all round. If you have a look at their abdomen as well, if you were to push on the side of their abdomen, just make sure they're not wincing at all. Make sure you're assessing their respiratory rate too, to see if they are calm and they're not breathing or having any distress while they're breathing. Obviously we do want them to be breathing, but make sure that they haven't got any distress while they're breathing. And also just check all round, check their bottom tube and just ensure that everything is healthy. Heart rate. Their heart is where you would expect their heart to be, actually there, just where your hand is, perfect. So you will be just feeling the heartbeat there. You can listen as well, so you can put your head on their chest to feel their heart as well. Obviously that's easier done when they're lying down. And again, you can check the respiratory rate doing that as well, so you can listen to the rate that they're breathing and check it with your watch. You only need to do 15 seconds, and then you would multiply that by 4, and that would give you your respiratory rate per minute. And the normal values can be found on the website. To take your dog's temperature, you'd get an ordinary digital thermometer, and you would put a little bit of water-based lubricant jelly on it, and you would very carefully insert it into the rectum and put it to the side of the mucosal membrane. So you actually push it inside the rectum and push it against the side. Otherwise you're just taking the temperature of the next stool they're about to pass. So you would be putting it against there, and obviously you would label that thermometer up and keep it separate from any human use. The easiest place to find a dog's pulse is their femoral artery, which is just inside their groin. And you would take it with your fingers rather than your thumb, because a human has a pulse in their thumb, so if you put your thumb on it, you'll be taking your own pulse. So you just push gently inside the groin there, and you should be able to feel the pulse. And then you would time it Take it for 15 seconds is the easiest, and then you would just multiply it by 4, and that would give you your beats per minute reading. What you should have in your pet first aid kit. First of all, we should all have a human first aid kit in the house and in the car. And inside this sort of kit, you have useful bits and pieces that will you'll be able to use on your pet and on fellow humans. There are extra things that we'll be talking about to have in your pet first aid kit, but in your basic human first aid kit, you can use some of these bandages, although you'll be covering them with some vet wrap, which we will show you here so that they won't chew through it as easily. You've got the basics that you can make an improvised muzzle from it. You can you've got some saline that you can irrigate a wound with. You've got triangular bandages that are incredibly useful just to stop bleeding. You've got big tough cut scissors that you can use to just cut around fur so that you can clean a wound. You've got a foil blanket in there that you can sit them on. You've got gauze that you can actually use to stop bleeding. So you've got useful bits and pieces in here that you can use for pets and for humans. So make sure you've got a good quality kit with good quality triangular bandages, ordinary bandages, crepe bandage, saline, and you can use some of this kit on pets, but please don't be tempted to give human medication to pets without clear veterinary advice and support. Right, in your little pet first aid kit that you can strap to your belt or just have in your bag, in a little rucksack, you need some vet wrap. So if you are using one of your ordinary bandages or one of these little bandages that you can have in here, so that if you're out and about and there is a problem, that you can stop any bleeding and sort out quickly. You can use this as an improvised muzzle as well if you needed to, or to bandage anything else that is bleeding or having a problem. There's a pad on here too that you can use to stop bleeding. You can bandage over with the vet wrap, which is really good, tough sticking to yourself bandage, invaluable to have out with you. You should have some scissors. You should have a triangular bandage, which is really useful for stopping bleeding, tying things up, different sort of bandaging you can do with this. It's a really useful bit of kit. It's the triangle that all the scouts and the guides use because it's so useful. You want to have saline in here. You can fit a lot in this little bag. Your foil blanket, which will keep them warm. So if they are bleeding or they're seriously ill or injured and the risk of going into shock, you need to keep them warm and dry. And also this foil blanket will protect your car or anything else to hold up sort of secretions and things if they're bleeding or have diarrhea or whatever. It can protect things as well, so it's multiple function. Gloves, really important, help you with all sorts of things, particularly if you're dealing with bleeding or any other vomit or whatever else is coming out of your beloved pet. Gloves are great. So we got your bandage, and you've also got a face shield. So if you are doing dog CPR, or indeed you could use this for human CPR as well, you've got a face shield in here that just protects you when you are doing that mouth to snout resuscitation. So have your ordinary first aid kit at home and one in your car, and have this out and about with you
so that if something happens and you need to help your pet, whether you're right in the middle of nowhere, that you've got the basic kit to be able to help them. Because don't forget, first aid helps preserve life, it prevents things worsening, and it helps you get them better. So prompt and appropriate first aid will actually reduce the amount of pain and suffering that your pet will experience, and it can help you prevent minor injuries becoming major ones. And if you know what you're doing, sometimes, very often, you can actually obviate the need to go to the vet at all. A lot of the time you will still need to go to the vet, but sometimes you can treat and look after them yourself.
Any dog that is injured or in pain or scared is prone to bite you. Even the calmest, most gorgeous dog, if they're hurt, they suddenly they develop different behaviour. It's safest to muzzle your dog if you are worried about being bitten. Never muzzle if you are concerned that the dog's having difficulty breathing, if they have any form of heat exhaustion because they need to pant, so they need to be able to open their mouth, or if they're at risk of vomiting. The easiest way to muzzle and safest way to muzzle a dog is to make a loop in a bit of soft gauze or pair of tights or whatever you happen to have. So make a loop, and you're going to approach the dog from behind and gently slip that over their nose. And then you tie it tight over the top, you tie one knot over the top, you tie one knot underneath, you slip it round behind the ears, and you do a quick release bow on the top. And that is tight enough to stop them from opening their mouth, but not too tight to cause any damage. Touch them with your foot just to see if there's any response. That way, if it was an aggressive animal, you could get back quickly and you're not going to put yourself at risk. You'd then move down and you'd stroke with the back of your hand. So just stroke them gently with the back of your hand. That's far less intrusive than stroking with the front of your hand. See if there's any response at all. If there is no response, then it looks like the animal is unconscious. You would then open the airway, so tilt the head back with the neck straight. If it is an unconscious animal, you would then pull the tongue gently forward. Boo is not unconscious, so we're not going to demonstrate that. I'll demonstrate that on a mannequin later. You would then check for breathing. So you would very carefully, and again, don't put yourself in danger because obviously your head is fairly close to their mouth now, but you would look down their chest and see if you can see them breathing, okay? So we can see that Boo is breathing, and in which case we would leave her in the recovery position, we would extend her head, and we might consider elevating her lower half if we suspected she was going into shock. And we would transport her to a vet quickly. Always phone the vet first.
You start by touching them with the back of your foot and speak to them as well. So you're not kicking them, you're just touching them gently with the back of your foot. You would then touch them with the back of your hand. It's less invasive than the front of your hand as far as they're concerned. If there is no response at all, you need to open the airway. So you tilt the head, lift their chin back, you pull their tongue forward a bit, and you check to see if they're breathing. So you would feel the breath. You could use a bit of your hair and see if it's moving underneath their nose, and you can feel if they're breathing. If they're not breathing, then I will need to start doing chest compressions. When I'm breathing into them, I'm being the lungs for them. When I'm pushing on their chest, I'm being the heart. So I'm being a heart and lung machine to keep their heart and their brain full of oxygenated blood, so that once they get to the vet, there's a much better chance of them making a full recovery. So I've checked for danger, I've approached them, I've checked for response. There's no response. I've opened the airway, I've checked for breathing, they're not breathing, and now I'm going to give them the compressions. So behind them like this. For most dogs, you would be pushing just on the side here, so just behind their front legs, and that's where the heart would be positioned. For something like a whippet, it's slightly more in the triangle between them, and if you have one of the flat-chested dogs like a bulldog or a pug, then you might want to roll them on their back, and you can be doing CPR on them while they're in the back. So put your hand over like this, the other hand over the top, and I'm pushing down hard and fast. Okay, 30 compressions, and then after the 30 compressions I would go back to giving 2 breaths. So 30 to 2, 30 to 2. Now the Blue Cross say that if you haven't had any luck and they haven't come back to life within about 3 or 5 minutes, it's highly unlikely that they are going to make a recovery. Give it your best shot. You are doing the very best possible that you can for them, and get them to a vet as quickly as possible.
If you suspect your dog is choking, the priority is always to keep yourself safe. Stay as calm as you can and help them by carefully restraining them, and then you want to open their mouth, which is sometimes easier done with 2 people and safer done by 2 people, and only do this if you are confident that you're not putting yourself at risk. You would open their mouth and you would check inside to see if there is anything obvious, which you would just remove with your finger and thumb. Don't be tempted to put your hands in or finger sweep round unless there is something very obvious that you can see. And it might be easier to use tweezers or forceps to remove anything. For a small dog, you would hold them upside down and you would gently shake them, holding them by their thighs, and gently shake them. Boo is clearly not a small dog, so for Boo, what we're trying to do is to get her into a position where gravity would help. So what we would do is we would hold behind her back legs and we put her in some sort of a wheelbarrow type position to see if gravity will help to dislodge that object. And you'd be looking to see if anything comes out. She could be coughing, she could be retching, she could be really struggling. If that hasn't worked, the next thing that you can do is a Heimlich manoeuvre for animals. The way you do this is if you have a look down their chest, there is a natural gap after their ribs, and it's in that gap that you're going to put your hands. You're going to make a fist with one hand, and then you're going to put the thumb part of your fist up underneath her abdomen there, and with the other hand you're going to put it over the top, and from upwards you're going to push upwards towards her chest, and that will hopefully be dislodging the obstruction by doing that. You would do that up to 5 times. If that hasn't worked, get the animal to the vet quickly. And even if it has worked, please get your animal checked out, your dog checked out, because having something stuck can cause damage, it can cause grazes to the back of their throat, and they really need to be seen by a vet to ensure that they are fine. If you have a small dog that is choking, then you would, in the same way as we showed with Boo, you would very carefully open the mouth and have a look. Make sure you're not putting yourself at risk of being bitten. And then with a small dog, you can hold them by their thighs, and you can actually shake them to see if you can dislodge whatever's got stuck. And then again, you would move on to the Heimlich manoeuvre, where you make a fist, put it under here, and up, and squeeze. And you do that up to 5 times, and then get them off to the vets as quickly as you can.